Dr. Jeff Dolgus. I get a lot of questions about Botox, so I wanted to make a video just to give you a rundown so you can figure out whether Botox might be an appropriate therapeutic option for you. Out of all the therapeutic tools I've ever used to treat TMJ problems, Botox has been hands down #1 when it comes to relief from pain caused by chronic muscle tension. I've had multiple patients use the same phrase when they return a couple weeks after administering Botox. They say it's a game changer. Now, I've used a lot of therapeutic tools over the years to treat TMJ pain, like laser therapy, TENS, ultrasound, trigger point injections, iontophoresis, and prolotherapy, and none of those things even comes close to the positive response I've gotten from Botox as reported by patients. Now, I administer Botox primarily to the masseter muscles. Sometimes I inject the temporalis as well, but mostly I stick to the masseters. And I typically use a 3-point approach with 20 to 30 units per side. This could vary based on individual anatomy and symptoms, but for most people, that's a pretty good place to start. It's important to understand that Botox is not injected into the joints. It's injected into muscles. Now, in case you're not familiar with what Botox and other therapeutic neurotoxins like Xeomin and Dysport actually do, they block the release of acetylcholine from motor nerve terminals, preventing nerve signals from ever reaching the target muscles. And the reason the masseter muscles are my primary targets for TMJ patients is because that muscle is our primary workhorse when it comes to chewing and clenching. Now, you can feel your masseters by putting your fingers right here and then clenching on your back teeth. You should feel those muscles bulge out. Now, if you don't feel your masseters bulge out when you clench, that could mean you have some sort of imbalance in your bite, or it could mean you have some inflammation in one or both jaw joints. It could also mean that there's some atrophy or just plain old weakness in those masseter muscles from avoiding using them, like what happens when you limit yourself to a soft diet for a long time. If this is the case, Botox is usually not the best option and could actually be detrimental. So the bottom line here is that Botox is an excellent therapeutic tool for TMJ symptoms caused by chronic muscle tension, especially right in this area. But if you have joint pain right in this area, or if you've experienced progressive clicking and locking of your jaw, then this probably isn't the best first step. As always, the first and most important step is a comprehensive TMJ examination and a detailed diagnosis. I hope you find this video helpful. Thanks for watching.